Today we are going to see about the continuity of last video, which is PNF introduction, principles and pattern of movements and techniques. In this video we are going to see about the PNF pattern for upper limb, PNF pattern for lower limb and PNF pattern for trunk and neck. Okay, so in this video we are going to see about PNF pattern of upper limb first. Model. Okay, in PNF pattern for upper limb we will be going with two patterns, that is D1 D2 flexion extension and D1 D2 flexion extension. So first we will go with D1 D2 flexion. This is D2 flexion and this is D1 flexion. See the pattern of movement. This is D1 flexion, this is D2 flexion, that is flexion, adduction, internal rotation and wrist flexion. Okay, same flexion, abduction, external rotation and wrist extension. This is D1 flexion, this is D2 flexion. So coming back, D1 extension and D2 extension. Now the upper extremity, upper limb, D1 extension and D2 extension. See, shoulder extension, abduction, internal rotation and wrist flexion. Again, so if you go with shoulder extension, abduction and external rotation and wrist extension. This is D1 pattern of, this is D1 pattern of extension, this is D2 pattern of extension. So that's it. Now we'll go with lower limbs. Pattern of movement for lower limbs is D1 flexion and D2 flexion, D1 extension and D2 extension. So now we'll go with PNF pattern for lower limb. Same D1 flexion and D2 flexion. First we will go with D1 flexion and D2 flexion. So in D1 flexion, hip flexion, adduction, external rotation towards the knee. Yes. Okay, this is D1 flexion. See, hip flexion, adduction, that is the external rotation. Always in 90 degree the hip rotation will be altered. If it is in, that is external rotation, if it is out, that is internal rotation. So in PNF pattern we will go with hip flexion, adduction and internal rotation, right? Wrist will be towards out, normal. Yes, relax. Now hip flexion, D2 flexion, where hip flexion, do hip flexion first. Hip flexion, abduction and internal rotation, do internal rotation and normal dorsiflexion. So this is D2 flexion for lower limb. So in D2 flexion, hip flexion, abduction, internal rotation and the foot will be in a neutral or dorsiflexed. Relax. Now lower limb, D1 extension. So now we will go with D1 extension, that is go with hip extension, abduction and rotation, internal rotation. See, extension, abduction and internal rotation. This will be your D1 extension. Relax. Next is D2 extension for lower limb. Same, hip extension, adduction, yes, adduction and external rotation. External rotation. See, this is D2 extension. Relax. Now we'll go with PNF pattern for trunk. That is, in trunk we'll split into two things. One is upper trunk, the other one is lower trunk. For upper trunk, the upper limb will be involved. In lower trunk, lower limbs will be involved. So when we go with PNF pattern for upper trunk, consider with your upper limb movement, diagonal pattern for upper limb movement. So in which the one limb will be in D1 flexion, the other limb will be in D2 flexion. Kai kothukong. Yes. So ask the patient to stabilize the lower limb. The therapist has to stabilize the lower limb and will remove the pillow. Ask the patient to go with the diagonal pattern of movement by lifting the upper trunk. Yes. See, your upper trunk will be lifted when you are going with the PNF pattern of movement for trunk. Upper trunk. Again. Yes. Again. Yes. Relax. Now that way. Okay. Go with the same pattern of holding your limb. Okay. Lift your head. Rotate and come back to this way. Yes. Again this way and the opposite diagonal pattern of movement. Relax. So in this way the upper trunk will be trained with the PNF for gaining a proper pattern of movement. Now we'll go with the PNF pattern for lower trunk. So during the time of lower trunk, we have to focus on lower limb diagonal pattern of movement. Okay, PNF pattern we have diagonal patterns for lower limb. So always consider with the diagonal pattern of movement. Ask the patient, you can go with bilateral movement of pattern. So if you go with that is D1 and D2 flexion of limbs, diagonally you will take with the D1 D2 pattern of extension where your upper trunk will be stabilized. Hold the upper trunk so that your upper trunk should not move from the place where the patient lies. Just ask the patient to move the lower trunk diagonally from one side to another. Flex. Don't move your upper trunk, just move. Okay, relax. Same way, bend your limb diagonally to one side and get it out to the other side. Same, repeat it again. Bring your flexed limb to one side and ask the patient to move the limb to the other side. So this is relax. This is the diagonal pattern for lower trunk where the movement will be possible on the diagonal sides of each one, right? So next we'll go with PNF pattern for neck. Now we'll go with PNF pattern for neck. So neck has the same diagonal pattern where your neck will be lateral flexed to one side and the chin will bend towards the opposite side. Okay, ask the patient to lateral flex to one side and ask the chin to touch the opposite side of the body. Relax. Again, lateral flexion and diagonally bend to the other side. Relax. Same, lateral flexion to one side, chin touches the opposite side of the neck. So this cross pattern of neck we call it as in diagonal pattern of neck, and where the PNF will be implemented to stimulate the opposite side pattern of movement. Again I will let you know, flex and chin to the opposite side. Again this side, flex, chin to the opposite side. That's it. So in this session we were seeing about PNF pattern for upper limb, PNF pattern for lower limb, PNF pattern for upper trunk, PNF pattern for lower trunk as well as neck. Thank you.